Financial Consulting Group 360 hosted an event on long-term care. We went over Medicare and Medicaid, explored the continuum of care that some might experience as they age, and the associated costs. Each attendee spent a few minutes thinking through how they might tackle their own healthcare crisis and need for long-term care. We then went over ways we can plan now to pay for these potential events. Our goal was for each participant to leave with a better idea of their own long-term care plan and ways they can plan now to reduce the burden on their loved ones in what is often a stressful time. Here's Elisabeth Olson, Certified Financial Planner, presenting some of the highlights from that event.
There is a lot of confusion about Medicare versus Medicaid. Medicare is health insurance for people who are 65 and over, basically. There's Medicare Part A for hospitalization, B for doctors and lab work, and D for drug coverage. If you decide to combine B and D, that's called Part C. That's also known as Medicare Advantage. And so that's Medicare. Just think health insurance. Health insurance, Medicare. Medicaid, there's two kinds of Medicaid, and it's important to understand that they're different programs. But Medicaid for health care, it provides health care for people who are low income or disabled. And so to qualify for that middle column, the only thing Medicaid will look at is your monthly income. People assume, well, I'm already on Medicaid, I can go into a Medicaid nursing home. No. The reason is because Medicaid for long-term care, they're going to look at not just your monthly income, but also your assets, which is, in my opinion, is as it should be. If you've got, $1 million, I don't think that it's fair to ask the taxpayers to pay for your care. I wanted to just talk a little bit about this continuum of care. I put those blue boxes on top because you might start off at home and then go to the hospital, and then from the hospital go straight to assisted living. And from assisted living, you might go into rehab and then go back to assisted living. Then you might go back to the hospital and then go to skilled nursing, and then you might be on hospice. Well, all those blue boxes on the top are covered by Medicare. I thought it would be nice to hear from an expert on this. This is LaFehr. She is a care manager. She has directed a number of facilities in this area that you would have heard of. And right now she's working in hospice. She's just going to talk a little bit about this continuum of care.
The continuum of care looks different for lots of folks depending on finances, but typically people start off at home, and if finances are not an issue, they bring care there. Then the next step is typically either independent living, where things are offered like meals, they have therapy in the building, potentially some non-medical home care at a more affordable rate. And then from there, you move to a little bit heavier care with assisted living or memory care. Those are both the same level, where it's still a lot of non-skilled care, assistance with showering and dressing, and they provide the med administration, 24-hour oversight, and then from there, it's typically to a skilled nursing facility if that is necessary. These days, a lot of things can be done either at home in independent living or assisted living in memory care, and a lot of people don't ever end up in skilled care.
Okay, my name is Jennifer Peterson, and I am the Admissions and Marketing Coordinator at Pointe Senior Care Community. We are a Greeley family-owned facility that has the full continuum: independent, assisted, memory care, long-term care, and rehab, all under one roof on one campus. So when you start at assisted living, you're going to be probably starting in the $2,500 a month. Potentially higher depending on which campus you choose. And then of course, if there's a second person, there's usually a second person fee. It can be anywhere from $750 up to above $1,000, and that would just be dependent on where you choose to go.
Okay, and how about when you get on the skilled nursing side, how much is it per month?
Sure, so that's usually going to be a daily rate, and I would say if you're looking at the month, it's going to be about $10,000 on the low side, and obviously higher depending on the campus that you choose.
If you look at this chart, and let's just say you've got $2 million or more, and you're like, our house is paid for, I think we can handle a $500,000 hit. Then you can definitely do that. That's an option for you. If you are a person of very limited means, and like our story about Mary who lived with her daughter, she really didn't have much. She is going to be a good candidate for Medicaid. And she did have to spend down, but she just had a little bit more than she needed. The vast majority of people in this part of the country are somewhere in between. And even my clients who have the ability to self-pay, who are up there in above $2 million of investable assets, many of them choose to have some kind of insurance just to alleviate the stress on the family. So here's your two options. Number one, self-pay. Number two, Medicaid. And number three, self-pay plus get some insurance.
Long-term care planning can reduce the stress in a long-term care event. We encourage all of our clients to take some time to think through their own plans and explore how those plans impact their financial plan. It's important to share what you have in place or are thinking about with your loved ones to make sure you're all on the same page. If you would like to explore this topic and options for ways to pay for a long-term care event, please connect with us, Financial Consulting Group 360.